Before we begin, I want to ask you something very important, and please answer honestly, even if only to yourself. If you have PCOS, struggle with weight that refuses to go down, feel tired all the time, crave sugar or carbs, or have been told you're borderline diabetic, this video is for you. And if you want clear, honest medical explanations without confusion or fear, make sure you subscribe to Medical Truths with Dr. Nimra like this video, and share it with someone who needs to hear this, because what I am about to explain is often missed even in clinics. Now let's talk about insulin resistance, the hidden link silently connecting PCOS, diabetes, and weight gain. Insulin resistance is not a disease you feel overnight. It is a metabolic condition that slowly develops when your body stops responding properly to insulin, the hormone responsible for moving sugar from your blood into your cells for energy. When insulin works correctly, your blood sugar stays balanced. But when your cells become resistant, your pancreas is forced to produce more and more insulin just to keep blood sugar normal. This excess insulin is where the real problem begins. In women with PCOS, high insulin levels directly stimulate the ovaries to produce more male hormones, known as androgens, which leads to irregular periods, acne, facial hair, scalp hair thinning, and difficulty getting pregnant. At the same time, insulin is a powerful fat storage hormone, meaning the higher your insulin levels, the harder it becomes to lose weight, especially from the abdomen. This is why many women with PCOS feel like they are doing everything right, but still gaining weight or failing to lose it. Over time, if insulin resistance continues unchecked, blood sugar eventually rises, leading to prediabetes and then type 2 diabetes. So PCOS and diabetes are not separate problems, they are part of the same metabolic spectrum, with insulin resistance sitting at the center. This is also why treating only symptoms like irregular periods or acne without addressing insulin resistance leads to temporary relief but long-term failure. You might be given hormonal pills, but the root cause keeps growing silently. Understanding this connection is the first step toward real healing, not just symptom control. Now that you understand how insulin resistance links PCOS, diabetes, and weight gain, the most important question is, can insulin resistance be reversed? The honest answer is yes. Most of the time it can be significantly improved, and in early stages, even reversed, but only if you address it correctly. The foundation of treatment is not extreme dieting or starvation, but stabilizing insulin levels. This starts with diet. Women with insulin resistance should avoid foods that spike insulin rapidly, such as refined sugar, white bread, white rice, sweet drinks, bakery items, packaged snacks, and sugary fruits taken in excess. These foods force the pancreas to release large amounts of insulin repeatedly, worsening resistance. Instead, your diet should focus on low-glycemic, high-fiber foods like vegetables, legumes, whole grains in controlled portions, nuts, seeds, and healthy fats such as olive oil and avocado. Protein is extremely important because it stabilizes blood sugar and reduces cravings. Include eggs, fish, chicken, lentils, and yogurt regularly. Timing of meals also matters. Skipping breakfast or eating very late at night worsens insulin resistance. Along with diet, physical activity is not optional, it is medicine. Strength training and brisk walking increase insulin sensitivity at the cellular level, meaning your body needs less insulin to do the same job. Even 30 minutes a day can create powerful metabolic changes. Stress management is another overlooked factor. High cortisol from chronic stress directly worsens insulin resistance and hormonal imbalance. Sleep deprivation has the same effect, which is why women with poor sleep often see worsening PCOS symptoms. In some cases, medications like metformin may be prescribed to improve insulin sensitivity, but medication alone will not work without lifestyle changes. Supplements such as inositol, magnesium, and vitamin D may help in selected patients, but they are supportive tools, not cures. The real cure lies in consistency, consistent eating patterns, consistent movement, consistent sleep, and patience. Insulin resistance did not develop in weeks, and it will not resolve in days, But with the right approach, your hormones can rebalance, periods can become regular, weight can reduce naturally, and the risk of diabetes can drop dramatically. If you understand and treat insulin resistance, you are not just managing PCOS or preventing diabetes, you are protecting your future health at its core. If this explanation helped you, make sure to subscribe, like, and comment below. Because awareness is the first treatment, and action is the cure.